Personal protective equipment, or PPE, is a vital component of infection prevention and control. PPE will help to keep you, patients, coworkers, and visitors safe from disease. Donning. Perform hand hygiene with alcohol-based hand rub. Rub hands together, rubbing palm to palm, in between and around the fingers, on the back of the hands, as well as the fingertips and nail beds. Continue rubbing until hands are completely dry. Visually inspect the PPE ensemble for rips, tears, or other damage. Don gown. Fully cover torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten at the waist and in back of neck if applicable. Ensure all clothing is covered by the gown. For donning a new procedure mask, secure the elastic bands behind the ears or secure the ties at the middle of the head and neck. Fit the flexible band to the bridge of the nose, ensuring a snug fit. Ensure the mask covers the nose and mouth. To safely don any reused mask, perform hand hygiene, don new gloves, reach into paper bag trying not to touch the inside of the mask, don mask and ensure proper fit, adjust as necessary. Discard gloves, perform hand hygiene. Don gloves. Ensure the bottom of the gloves cover the wrist area of the isolation gown. Skin should not be showing. Change gloves when torn or contaminated. Perform hand hygiene between glove changes. Prior to entering the patient room, the healthcare worker should verify the integrity of their PPE. This is to assist the healthcare worker to remove PPE without contaminating clothing, skin, or mucous membranes with potentially infectious materials. For patient rooms with anterooms, remove all PPE. For patient rooms without anterooms, remove all PPE except eye protection and mask or respirator. Healthcare workers need to avoid reflexive actions such as touching their face until the doffing process is completed and hand hygiene is done. Inspect PPE to assess for visible contamination, cuts, or tears before starting to remove. As the healthcare worker removes each item, place the contaminated PPE immediately in the designated waste receptacle. The front surfaces of all PPE is contaminated. If your hands become contaminated at any time during the doffing process, immediately complete hand hygiene. To begin the doffing process, grasp the gown on the front and pull away from your body so that the ties break, touching the outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out and bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Dispose and complete hand hygiene. Remove mask. Ensure hand hygiene was completed prior to the removal of the mask. When removing a procedure mask, remove by grasping the ties or elastics from behind the ears. If the mask has ties, grasp the bottom ties first and then the top ties, without touching the front of the mask. If the procedure mask is to be reused, fold mask carefully so that the outward surface is held inward and against itself to reduce contact with the outer surface during storage. Place the mask in a paper bag labeled with your name. Performed hand hygiene.